I am certain that there are many cases that are treated by private doctors that go unreported. This is true also of some cases here in Dallas. I question, however, that the figure is 4 or 5 times the reported cases.
Why would Dallas be different, let's say, than the overall picture of the nation?
By that you mean
yeah.
Dallas has the reputation of having a very high incidence, for instance, of venereal disease. Do you mean in that respect?
No, I mean in the respect that you said that you could take Dallas and look at the figures, and those could be accepted as reasonably accurate. But for the nation, you know, the theory that 3 or 4 times that might be the real figure.
Well, the reason I feel that this is true for the Dallas area is because Dallas has had a comprehensive venereal disease program since 1937. The program has been in existence through these years. In the experience that I have had personally through all of these years is the thing that makes me feel so strongly that the figures reported from the health department gives us a fairly good representative picture of the situation here. My own personal experience with many of the doctors is that I actually feel that here in this area, doctors actually treat fewer cases of venereal diseases than they treated 20 or 25 years ago. In other words, I think more patients with venereal disease went to private doctors 20 or 25 years ago than are going now. But a good many of the doctors are not too interested in treating venereal diseases.
They may come in the front door and see first the information desk, and they will be referred up to the adult clinic, which is in room 225. Registration for the adult clinic is separate from all other clinics within the health department. The first thing that the patient will do is to see the receptionist. If they have not been here before, she'll make out a record on the patient, asking them their name and address, so that we can get in touch with them if we need to, and that is all that she really needs to know from the patient. And then she sends them to the patient waiting room, where they will wait for a few minutes until they're called. In the examination room, the patient is screened for any signs or symptoms that they may have of venereal disease, and we talk about any problems that they may be having. They are treated if it's indicated. The patient is sent to the interview room if they are actually infected with the disease. Here, one of the investigators will talk to the patient, and what we do when we talk to the patient in the interview is, first of all, we try to explain to the patient a little bit about the disease that they have, how they got it, try to help them understand how they might not get it again, explain to them what it could have done to them had they not gotten treated, explain to them it's important that they complete all of their follow-up and any further treatment that might be necessary, as well as try to obtain from them contacts whom they were exposed to or they might have exposed to the disease, and explain to them that this is actually part of their treatment, that if everyone involved in the chain of infection doesn't get treated, they're very likely to be reinfected with this disease and be back at this point again, reinfected and starting over. Once we get in touch with a contact and explain to them what the situation is, most of them are very cooperative and are very understanding and do either report to their private physician for an examination or come here to the clinic to make sure that everything is all right with them, since we do explain to them that they could have the infection and not actually be aware of it. We are extremely concerned about making sure that all of the information we have is kept confidential and that the patient not be exposed as having a venereal disease. It it would probably be more convenient for the patient if we had neighborhood clinics throughout the county and throughout the city. I don't think this is a realistic goal, and I have been in areas where they have had neighborhood clinics, and we've run into the problem of people not wanting to go to their local neighborhood clinic because they're too well known in that neighborhood, and they prefer the anonymity associated with a larger clinic.
Problem with VD and satellite clinics is that some patients don't like the connection that if they are seen by someone that they know going into a VD clinic, that person in their community, that person will already, automatically suspect that they have venereal disease, so that in some instances this does not work. To get around that would be then to provide comprehensive health services at that center, provide family planning, provide obstetrical care, well baby clinics, venereal disease testing, a multitude of comprehensive services right there, so that you're not identified as going into one building for one particular purpose.
Mr. Blancato, locally, what factors do you think are contributory to the VD problem?
Well, there's many factors. Anytime you have a city as large as Dallas, you're having people coming and going. The PD rate is going up all over the country. We are a major metropolitan area. There is looser sex mores. So these all fit into the picture. As far as just pinpointed on one factor, it's hard to say.
How serious do you regard the problem?
Well, we definitely have a major venereal disease problem in Dallas, especially with gonorrhea. The gonorrhea rate is going up here, and we realize that it is a problem, and we are trying to screen as many females as possible now throughout the city. We have 2 all-day clinics, so hopefully we can make a dent. But in answer to your question, we have a very serious gonorrhea problem here. Syphilis, we have a syphilis problem in Dallas, but not as large an increase as gonorrhea in the last year.
Are local facilities adequate for treating the diseases?
They sure are. We've got 2 all-day clinics here in Dallas. We've got one at 1936 Amelia, which is across from Parkland Hospital, and we also have a clinic in South Dallas at 4500 Spring. And these clinics both operate from 8:30 to 5. So there's no reason for a person in the city of Dallas or the county of Dallas or this area that has a problem or thinks they have a problem for not getting it taken care of. We've got the facilities to take care of them.